Hi, my name is Indy. I'm a scientist, and today I'm going to talk to you about Botox. Well, actually, in Australia, it's referred to as anti-wrinkle. So, Botox is actually a neurotoxin, which is something that stops the little transmitters in your muscles from telling them to pretty much work, so contract. It was found in a bacteria that was causing havoc in Germany a couple of hundred years ago. And a few clever doctors discovered the bacteria Bacillus botulinus, but nowadays we call it Clostridium botulinum. And they discovered that it actually makes several types of different neurotoxins, and they picked the strongest one, which is called type A. Initially, this is used by ophthalmologists to correct strabismus or eye twitching. And then this beautiful, clever ophthalmologist called Jean Carruthers noticed the anti-wrinkle effect it was having on her patients. She talked to her dermatology husband, and they decided to create and purify this toxin A and create Botox for anti-wrinkle. And now we have different brands. So that's why it's referred to as anti-wrinkle. Botox is actually a brand. So Botox Cosmetics is the brand. There's Dysport, Xeomin, Juvet, and Daxify. In Australia, I've only ever seen Dysport and Botox in the clinics that I've gone to. No judgment if you've had Botox or if you don't like Botox. This is just to educate you more if you're looking at getting it, so you know what you're putting in your face. Don't have any in right now. I get it in my forehead, and actually to treat my gummy smile, I used to get it in these muscles that run alongside here, and it would just kind of drop my lip a little bit, so it wasn't gummy. But I have had it done. I don't have any in at the moment, and that's because I'm actually concentrating on my overall loss of collagen because I'm older now. But if you do have things like hyperhidrosis, which is the excessive sweating in the hands, you know, sometimes Medicare do grant rebates for that. To work at a dermatology clinic, I did talk to a doctor that was using it to help with some certain types of back pain. I had post-stroke, twitching, some genetic diseases, uncontrollable muscle spasms in certain areas. They were using it to treat those. Hopefully you've learned a little bit more about Botox and anti-wrinkle. So if you are looking at getting it done, you know what you're putting in your face and a little bit of background behind it. Disclaimer, I am a scientist. I'm not a doctor or a dermatologist. I don't have a PhD or a doctorate.